So today I will tell you the uses of LODOPIN tablet. I'm your pharmacist, Dr.Abdur Rafy. I'm doctor of pharmacy. I have a specialty in pharmacy. I'm a drug expert and you're watching Rafy Healthcare channel. So let's start. Its brand name is LODOPIN and its generic active pharmaceutical ingredient is Amlodipine Besilate. It is a 5 mg tablet and its manufacturer is Martin Dow marker. Amlodipine is the active ingredient here. It is an antihypertensive medicine which belongs to the calcium channel antagonist drug class. It is used to treat and control the high blood pressure. It is also used to treat hypertension. It is also used to control and treat angina pain also. Basically, it is used to treat high blood pressure. It controls the blood pressure by relaxing the blood vessels. So it's a very good and effective medicine. Now I will discuss some tips for you to how to use it. You should take it orally by mouth and you should not chew it. You should just swallow it with water. You should not use it and mix in water and then drink it. No, that's a bad practice. You need to just take the tablet, put it in your mouth and just swallow with the water. Okay, it is the best way. You can take it with meal or without meal also, but if you have stomach problems without meal, so you can take along with the meal. But it is better to follow your physician and pharmacist because patient to patient it varies and also from the case. If you have missed the dose, you should take it as you remember, but make sure that this next dose doesn't interfere with it or you will have a lot of side effects. So that's why you need to take the precaution and you need to take care of these things. If you are having any kind of side effects like headache, vomiting, weight gain, palpitation or difficulty in breathing, you should not use it and you should tell your physician and pharmacist. And specifically if you are allergic to this medicine, you should not use it, or you are sensitive to amlodipine, you should not use this medicine. Okay, we have a lot of medicines, we have a lot of antihypertensive other than amlodipine which are also good. So the doctor and the pharmacist will prescribe you other medicine. Okay, you don't have to use this medicine. You should also check your blood pressure regularly to monitor your blood pressure, that what's the progress of your condition. Is it getting good or is it getting bad? You should consult your physician. If it is getting bad, you should tell him that why I'm not getting good. Okay, then he or she will prescribe you another medicine and then you can have a good progress. So I hope you understand the video and found this video informative. Don't forget to subscribe my channel because I work very hard to make videos for you. So please give it a thumbs up also and share this video also. Thank you. So that's for today. So I hope you found this video informative. Please like it, share it and subscribe to our channel. And if you have any question regarding this medicine or any kind of medicine, drop in the comment section. I will reply you. And now take care of yourself and always remember your pharmacist Dr.Abdur Rafy in your prayers. Allah Hafiz and take care.